my gratitude for the kind invitation of Dr. Samer El-Morsi Hassan and the EWNC to participate in this magnificent event. I am Luis Miguel Duchenne Rodriguez, neurosurgeon from La Paz, Bolivia.
Today, I will show you the functional results the administration of ozone and plasma-rich platelets as treatment for low back pain in lumbar disc herniation. Low back pain is a disorder with a significant impact of the clinical status for patients with socioeconomic and public health consequences. In 2016, the United States spent $134.5 billion for the management of patients with low back pain. Intradiscal administration of mixed ozone and platelet-rich plasma is a minimal invasive and low-risk alternative for the treatment of pain caused by unilateral disc. The objective of this work is to determine the functional result of the administration of ozone and PRP in patients with low back pain and low back pain with radicular radiation secondary to lumbar disc herniation. This is a longitudinal prospective study for January 2016 to March 2020 that included patients with low back pain and low back pain with radicular radiation who underwent intradiscal phase-induced periarticular and epidural flow rate injection ozone and platelet-rich plasma under fluoroscopy, local anesthesia, and sedation on one-time outpatient basis. They were evaluated pre-intervention visual analog scale and Northwestern disability scale at weeks 1, 2, 24, 48, and 86. Magna criteria are years after the intervention. The inclusion criteria were lumbar and radicular pain caused by protruded or extruded disc herniation documented with MRI. Failure or conservative treatment performed for 6 weeks. On the other hand, the exclusion criteria were Cauda-Equina syndrome, motor deficiency, sequestered or intradural herniation, previous spinal surgery, concomitant spinal tumor, traumatic or infection disease, spinal instability, coagulation disorders, hyperthyroidism, infiltration with corticosteroids and the last 6 months, pregnancy, serious psychiatric illness, medical legal disputes, use of anticoagulants. All patients were prepared with cardiological evaluation, preoperative labs, lumbosacral MRI, lumbosacral dynamic radiograph. All signaled a written authorization for the procedure. Blood was obtained at venoculture and use of vacutainers. The blood is then centrifuged and the platelet-rich plasma is separated in laminar flow chamber. In the operating room, the administration of ozone and PRP is performed under sedation and local anesthesia with fluoroscopic guidance using Chiba needles with the patient decubits. In these images, we can observe the administration of ozone and PRP under strict antisepsis. We can observe the insertion of the needle into the L4, L5 discs. The needs increase the height of the L4, L5 discs after administration of ozone and PRP. Then needles in fascia joints and finally the needle in epidural space through the sacral hiatus. The range of fascia joints and epidural space, 22G spinal needles are used. This imaging shows the change of the intervertebral disc comparing the state before the intervention at 4 weeks and 12 weeks later. It's important to note the portion of extruded disc is that reduced in size. The imaging shows that the non-extruded portion of the disc doesn't dehydrate after the procedure and even a slight increase after 12 weeks. Axial images show the reduction of disc and reduction of rod compression. There seems to be some space between the nucleus pulposus and the annulus fibrous in the imaging after 12 weeks of treatment. We included 55 patients, 24 women and 31 men. Average follow-up was 25.84 months. 78 patients presented log 1 pain with radicular irradiation, 22 axial log 1 pain. Writing the treated levels, the majority, 51%, were L4, L5, and L5S1. We evidenced a clear reduction of the BAS values from the first week, which remained sustaining until 96 weeks. Similarly, the value of ODA decreased drastically from the first week and remaining until week 96. The values of the MAGNAF scale show 85.5% of favorable results, excellent, and good. Currently, there is a lot of literature of variable quality that supports the use of ozone in PRP for pain due herniated discs. We will review the most significant. Ozone is an inorganic molecule with allotrope properties consisting of 3 atoms of oxygen with cyclic structure isolated for the first time in the 839 for Christian Friedrich. Ozone is present in the nature in the smart forest, but also produced artificial by subjecting the atomic oxygen to high voltage electrical disgrace and appears colorless in gaseous form with a characteristic smell. Unfortunately, it's cannot stored because the ozone is high in stability. Moreover, the medical gas mixture concentration solid composite is no less than 95% to oxygen and no more than 5% of ozone. Several papers suggested several medical features of ozone, including bactericidal and virucidal properties, inflammatory modulation, and circulatory stimulation. Ozone effects on the inflammatory cascade interrupt breakdown arachidonic acid to inflammatory prostaglandins, leading to decreased pain. Inhibits the synthesis and release of pro-inflammatory cytosine was prostaglandins A2 and bradykinin. It stimulates release and anti-inflammatory cytosines. Generates hyperoxygenation. Derive reduces pain by direct and indirect mechanisms, increasing tissue oxygenation by 2,3 diphosphoglycerate within the erythrocytes. Theoretically, is what achieve breakdown of glycosaminoglycan while reduce ability to hold water, which turn leads a significant drop of intradiscal pressure, never of the life. In our opinion, this dehydration only occurs on the extruded disc. The non-extruded disc maintains its hydratation as shows this MRI. Ozone will also proceed with stimulation of fibroblastic activity, which allows repair process by stimulating collagen production. The other hand, PRP is autologous blood concentrate that relates abundant particles contain high concentration of proliferation and differentiation, promoting growth factors. Triggers a serious change that promotes the tissue repair. Activated platelets releasing growth factors and adhesion molecules mediate a varied cellular interaction, chemotaxis, cell adhesion, migration, cell differentiation, and stimulate to immunomodulatory activities. This platelet cell-cell interaction, activated platelets releasing growth factors and adhesion molecules mediate a varied cellular interaction, chemotaxis, cell adhesion, migration, cell differentiation, and stimulate to immunomodulatory activities. This platelet cell-cell interaction contribute to angiogenesis and inflammatory activities, ultimately to stimulate tissue repair process. Of the multifaceted 5-hydroxytryptamine responses following inflammatory PRP, after platelet activation, platelet release their granules, including 5-hydroxytryptamine from dense granules, inciting a wide range of differential effects in various immune, endothelial, and smooth muscle cells. Activated platelets release many pro- and anti-inflammatory mediators that are proficient and inducing pain, but can also reduce the inflammation and pain. The injection on PRP is effective to enchasing extracellular matrix accumulation, retaining a high Dix height index, increasing the T2 signal intensity, and slowing the process and possibility reversing the effects on intervertebral disc degeneration. PRP is anti-apoptotic, cell proliferation, and anti-inflammatory effects that increase the synthesis of collagen and aggregates they manage to maintain to a decay where they contain then restores the elasticity and height to the disc. In this study, 80 patients were divided in 4 groups of 20 patients. Lumbosacral CTs performer and interleukin 6, AGM, AGG, and superoxide dismutase were tested. A control group maintained and different concentration of ozone were administered to the others. CT shows that the 40 micrograms ml group had a great reduction of volume of extruded disc. The same group present great reduction of concentration for interleukin 6 and AGM. It also showed the reduction of AGG and increased the superoxide dismutase as evidence of increasing the antioxidant activity. Of the value of the BES as also better the 40 micrograms group. It followed the appropriate dose of 40 micrograms ml. This other study showed that doses of concentration of 30 and 40 micrograms ml had same clinical results. This paper showed that effectiveness of ozone is sustained follow-up to 10 years. This group of items including 3,500 patients achieves 75 to 8 good results. This British journal shows functional results similar to those obtained by us. I must emphasize that ozone was administered not only in the discs, but also the facet joints, paraganglionar, and paravertebral levels. This Italian study identified success predictors: pain duration lasts less than 1 year, MSU tip of disc herniation 1A, 1B, 1C, 2A, and 2B, disc degeneration grade 2, and absence of foraminal stenosis are associated. The Spine Journal published a multi-center pilot prospective randomized control trial conducted of 3 European hospital spine centers comparing the ozone administration with microdiscectomy. Identified that there are no significant difference between the functional result obtained with microdiscectomy and intradiscal ozone administration. This study randomized patients into the 3 groups: surgery, ozone administration, and oxygen administration, establishing that only 20% of patients receiving ozone required surgery versus 60% of those receiving oxygen, which drastically reduced to the cost and hospitalization. This double-blind study shows that corticosteroid no is necessary when intradiscal ozone is administered. This paper shows that there is no difference in 3 and 6 months if we compare ozone, foraminal corticosteroid, and pulsed radiofrequency. Stefan et al. Establishing on this meta-analysis that oxygen ozone therapy is effective and extremely safe, achieving pain reduction and improving function in patients aged between 33 and 94 years with all tips over 90 discs. In addition, they established that the improvement in pain and function are similar to results obtained with discectomy with much higher complication rates. Ribeiro et al. In this systematic review with meta-analysis and rhabdomyosity study established that ozone is more effective than other therapies to management the low back pain. On the other hand, this study shows functional results to the administration PRP and similar dose of ozone. The Belgian study establishing that PRP is safe therapeutic solution with a very positive cost-effective and simple relationship to implement and that no human studies have reported negative side effects. This North American group establishing good results to pain control with PRP after 9 years of follow-up. This New York study conducted a prospective randomized controlled double-blind study with inclusion and exclusion criteria similar to ours. They found evident improvement in functional results after the administration of PRP versus contrast alone. This Euro-Asian randomized double-blinded controlled study comparing PRP and corticosteroid on the management of degenerative spinal pain showed the superiority of PRP. This meta-analysis showed the effectiveness of intradiscal PRP to the management of discogenic low back pain. In summary, ambulatory multimodal percutaneous administration of ozone and PRP achieves pain relief in patients with low back pain and low back pain with radicular irradiation by regulating the inflammatory processes and reducing the volume of the degenerative nucleus pulposus in patients with lumbar disc herniation. Level evidence 1 for PRP, 1- for ozone. In conclusion, the multimodal administration of ozone and PRP is effective and safe to treat patients with low back pain and low back pain with radicular irradiation secondary to lumbar disc herniation in selected patients, achieving good functional results measured with BAS, ODA, and MAGNAP. Thanks for your attention.
Thanks a lot, Professor Lewis, for this excellent presentation, which is augmented with multiple research papers.